Welcome, welcome.
Yeah, recovery to resiliency. The title of this one is Harm Reduction, meeting you where you are in your recovery.
Yes.
We're going to be sort of diving into compassionate, which is important, and a compassionate sort of approach and pragmatic approach to harm reduction, particularly when it comes to substance use, recovery, and especially for the population that we've been focusing on, which is pregnant and postpartum individuals.
Yes.
We'll talk about personal journeys. What are some professional insights on looking at and embracing? Embrace being a really good term to describe what we want to do for harm reduction. Embrace those strategies because we want to support individuals in their unique paths towards healing,
And
resilience,
yes,
recovery.
and recovery.
Yeah. Amani.
Yes, we have a special guest here with us today. Her name is Miss Quinnie.
Hi, good morning. Good morning. Glad to have you.
Yay.
Glad to be here.
I'm so happy to have you on our show. Today, we're going to go over just the stigma first of harm reduction. I know I never heard of harm reduction until I started working for Empowered. And the stigma for me was, I was like, why wouldn't we just want people just to be abstinent from using? Why would we provide things that would help them continue using? And not until someone explained to me truly what harm reduction, I'm so on board for it. We definitely need this.
Yes.
So what do you think about harm reduction, Ms. Quinnie?
I'm really all for harm reduction, being that they have the MAT treatment program, medicated assisted treatment program. I think that for those that are struggling and they need some type of assistance to help them get off the drug, I think that it's imperative that they do get that help.
That is true.
Because it helps them to function. It helps them to be able to work and do the things that they need to do while being medicated. And then it stops. It lowers the risk of overdose. It lowers the risk of them going back and forth to jail because
true.
now they're working. They're being citizens and, being help in the community. So I think that harm reduction is a big thing. They didn't have that when I was introduced to recovery, but we'll talk about that later on if you want.
Yes,
Yeah,
I'm
no,
so
absolutely.
sorry. We jumped on. I was so excited about harm reduction that we forgot to explain.
That's exactly what I was going to get to. I was going to say, okay, hit the pause button.
Yes.
But I totally get it. We want to jump in and dive into this.
Yes.
But let's sort of do a rewind.
Yes.
So we can talk a little bit about introductions. Okay. Me, Dr. Farzad Kamyar, psychiatrist in addiction medicine, and I'm joined by Amani Wilson, who has a bunch of different titles and has a bunch of different skills. Okay.
Right.
But yeah, we're being joined by Miss Quinnie.
Yes.
Okay. Miss Quinnie, can you now tell us a little bit about just yourself? Like, what's your role with the Empowered program
Yes.
and what are you doing?
Okay, so my name is Quinnie. I am a certified peer recovery support specialist. Recently just got my certified supervisor peer certification. I have been at Empowered program now. I'm going on 6 years. I love the program. I'm not just saying that because I am there. It's a big part of me, I feel, of still being clean and sober. I feel that being at the Empowered program, while we're talking about harm reduction, is a big part of me still being clean. So that's harm reduction. I also wanted to say that I feel that being a part of the Empowered program is like, it's not just me helping others. Little do they know that while I'm helping them, they're helping me stay clean one more day. So I just love being there with the women. We help postpartum and pregnant women that have opiate and stimulant dependency. Sure. And so our thing is to be able to help them with resources, housing, OBGYN, whatever they need, we're there for them and to meet them where they're at.
Yeah, meet them where they're at. And I think that, go ahead, sorry.
No, I just wanted to say that Miss Quinnie is truly someone special to me, because when I first started the Empowered program, Miss Quinnie, I would seriously call her every morning at 6 o'clock in the morning.
Yes.
That's when she started. And I would call her and just literally, she was that support that I needed in order to get me where I am today. So I just have to say thank you, Miss Quinnie.
Yes.
Thank you for being
No
here.
problem.
You're just truly an amazing woman. No, you deserve all the claps. I appreciate you. I just had to say that.
Of course. No, of course. And thank you for that. So, Quinnie, you had mentioned two terms. One was meeting you where you're at, but the focus of today's episode is harm reduction.
Yeah.
So the first little bit that we're going to cover is understanding harm reduction. So let's take it back and let's dive back into harm reduction, but going all the way back to the basics, which is what would you say is harm reduction for our listeners and viewers who might not know what that is?
Harm reduction today is fentanyl, Narcan, naloxone. Harm reduction is being able to, like I said, the medicated assisted treatment program. Harm reduction is having peer support. Because I feel like being able to have somebody there to support you is a big thing. For me, if I didn't have family support, empowered, if I didn't have the support that I had, I don't know if I would be as far as I am today.
Sure.
So support is a big thing too. I think that has a big thing to do with
It does.
harm reduction
Sort of
as
harm
well.
reduction, yeah.
Yes.
What are your thoughts? What would you say for our listeners and viewers?
Well, from what I've gathered, just from my little bit of research in harm reduction, I feel like harm reduction is things like clean needles, I was listening in on to a meeting and they were talking about just even giving foils, clean foil, needles, other utensils that people may use that may cause illnesses if they were sharing, things like that. So that's my understanding of what harm reduction is. Like Ms. Quinnie had mentioned the Narcan for overdosing. But this is all still new to me. This is all still new.
And also I just want to interject right here. And also they are putting these machines in different locations that they have easy access to clean needles.
Oh, that's
supplies.
amazing.
Safe sex
That's amazing.
items that's in there, paraphernalia, where they can get clean needles and all the
is
things that
so
they use
amazing.
that they would use as far as being safe. If they're going to use, be safe.
Yeah.
So that's a big thing.
Kind
to
of-
go somewhere and you can see a machine there and say, okay, well, let me exchange this and get a clean needle so
Kind of-
I can be safe.
Yeah, giving somebody a chance to live another day
Another
so
day.
that they can start their journey into recovery.
Right.
Yeah, and so from my perspective, I mean, we can get into the nitty gritty of what's maybe the formal definition of harm reduction, but I want to take a real simplistic approach and do something that we oftentimes try to do, and we'll probably end up doing this during these podcasts, is comparing it to reduce the stigma of substance use and mental health treatment, comparing it to other chronic issues, because we
Yes.
do view mental health and substance use as chronic medical issues, point blank, done. Okay?
Indeed.
So in my head, I am going to approach that as I would other chronic issues, of which a really popular one that's very prevalent in the United States, diabetes.
Yes.
So you'll oftentimes hear me make those comparisons. And just to put a little bit of context behind that, most recently, the amount of folks in this country that have diabetes, we'll say 38, 39 million. As of 2022, the amount of folks that have just a substance use disorder, not a mental health, right, but just substance use, 48 million.
Yes.
Yeah.
So there is
that's a big
significantly more people in this country that have substance use disorder versus diabetes. All right, so
Crazy.
It's about time
Yeah.
we treat things
Definitely.
the same.
It is.
So in that context, the notion of harm reduction, I believe, is not unique to just substance use treatment. We do it for other chronic issues as
We
well.
do.
And here's sort of my boilerplate, real basic definition. It's actually just those two words, harm reduction.
Yeah.
Okay. What can I do? What can I offer? How can I support you to in any way reduce the harms associated with fill in the blank? So in the case of substance use, in the case of reduce the harms associated with substance use, or in the world of diabetes, reduce the harms associated with diabetes.
Yep.
And that's it.
Information.
I mean,
Information
it would be
is
hard
fun,
for
yes.
me to try to give you all the examples of what I view as harm reduction because they're plentiful.
Yeah.
There is a bazillion different things I
You're
can think of.
right.
Ones that you have mentioned. It was your program. It was step meetings. It was your family.
Yes.
Medications. What is cool is that I think now we're seeing an evolution of what harm reduction looks like. Things that we didn't have before, Quinnie. I think when you were first sort of initiating the road to your recovery, things like clean needle exchange,
Yes.
right, or cleaning using supplies, kits, maybe all the safe sex stuff. So we're looking at transmittable diseases reduction. We're looking at medications. So a medication that is life-altering, life-changing, life-saving, which is newer in the past 20 years when it comes to the realm of opioid use, is buprenorphine. Also another one, naltrexone. Those didn't exist back when
I
were
started.
And so now we have medications. And in 10 or 20 years, when we replay this podcast, we might be in a spot where we're looking at ourselves and laughing at, oh, that's all we had back then?
That you are so right.
Yeah. So I think we have a fairly firm grasp on what harm reduction is.
Yes.
Well, what are some ones that we haven't mentioned? My gosh, we've talked about, I guess, forget what I just said about what are the ones that we haven't mentioned, because for our viewers and listeners, just think anything that reduces the harms associated with your use, I'm thinking of as harm reduction.
Yes.
It's mostly that I'm glad we're headed towards the path of reducing the stigma associated with it.
Harm reduction.
Yeah,
Yes.
with it. Because, Quinnie, like you had mentioned, now we have, needle exchange. These are vending machines. Vending machines.
That
right?
is
Any location.
mind-blowing.
Yes.
That is
You can go to
mind-blowing.
Track B and get the information. You just get a special card with information on it, and you use it. It's private. You can go and punch that number in. I don't know if they changed the process, but that's how it was when I was associated with them anyway. And you put your number in, and you just pick what you want. So
Right.
Amazing.
Before we get to the part, which is I want to hear your stories about
Yes.
how harm reduction helped in your lives or didn't help. I mean, whatever,
Right.
right? This is a free for all.
Okay.
I want to finish the first section by saying, everything that we sort of recommend, and I should be recommending, should be evidence-based, right? And our evidence clearly shows that harm reduction strategies, even though they have stigma, and I get it, I get what folks have concerns with, are things like this going to sort of, enable those
I've
who are
heard
using
that.
substances
Yeah.
to
I've heard
use
that.
instead of quit and all those kinds of things. And just frankly, that's not what the evidence
That's
shows.
not what it is.
So things like, here are the heavy hitters, things like Narcan, overdose reversal. We have the clean supplies, that's a big one. And what's sort of hitting the limelight most recently, because fentanyl is now ubiquitous, which means everywhere.
Yes.
We see it in cannabis, we see
Everything.
it in methamphetamine, we see it in all the substances you can talk
Everything.
about.
It's no
So
escape.
fentanyl test strips have become
Yes.
huge as a
Right.
harm reduction strategy. Okay? That's out of the way. Those are all evidence-based. They are, no questions asked, saving lives.
Right.
Okay.
No, not at all. And I can appreciate having the Narcan because I want to mention at the Empowered program, you know how I go out in the community sometime, and if I don't hear from a certain patient for a certain amount of time, I do a wellness check. And if they tell me that, yes, they have relapse or they have used, I have some in my backpack
Oh, absolutely.
where I can give them that because I'd rather them have it than
Yes.
Yeah, I mean,
because it'll save their life.
Yes, it does.
Yeah,
Yeah.
saving lives. I mean, taking that analogy back to other chronic issues, just think of all the places you have gone to and you see an AED, right?
Yeah.
That's someone's having a heart attack, a
Defibrillator.
Yeah.
defibrillator, right? Boom, boom. We're at a point now where we talked about this. The number of overdose deaths are outpacing things like that, right? So effectively having Narcan available in public places and all these other places that we're talking about, it's the same. It's going to save someone's life.
It makes a difference.
You administer Narcan, and if someone is experiencing an opioid overdose, there is a dang good chance that person is going to be alive.
Yes.
That's a marvel of modern medicine.
Yes.
That we have something like that.
That's what harm. I just want to say one more thing.
No, please.
That's what harm
Please.
reduction is being able to live one more day.
Yes.
One more day.
That's what it is.
One more day.
Yes.
Okay, so Quinnie, along those lines, I've been doing a lot of speaking, so now I want to hear you all. Okay, I want to hear
we need all
how
the
has
facts.
how has harm reduction sort of helped in your path to recovery? Give us some of that journey story.
Okay, so I'm going to have to go back. So as you know, my journey of recovery started back in the late 90s, 2000. So, and like you were saying earlier, we were talking about they had no type of harm reduction back then. And my drug of choice anyway was cocaine. So there is nothing for that. You have to kick it and go through whatever it is and just suffer the consequences. So, but that's not the point. The point is, the only thing I knew was, like I said, spirituality, family support, AANA, jail, prison programs. I went to a lot of programs. I went to prison back and forth in jails. But I'll tell you this. And the reason why I say harm reduction is because every time I went to jail, it saved my life.
Yeah.
Every time I went to prison, it saved my life. Every time I went to a program, even though I left the next day, or I left after 4 days, whatever it was, my life was saved for those 4 days.
Amen,
So that was the only, and my family was always praying, and my family just, being there, trying to support me along the way, never giving up.
Yeah.
Always telling me that no matter what, they're there for me. I'm going to make it. That brought me a mighty long way. That's one big reason why I'm sitting here, and besides my spirituality.
Sure. Amani, what were some of your personal experiences with, and what did your journey look like when it comes to harm reduction specifically?
Well, actually, like I said in the beginning of this podcast, I had no clue what harm reduction was until I actually started working for Empowered. So I really didn't understand, but also I didn't know that like my drug of choice was meth, and there's different means of using meth, and I guess smoking the meth is a harm reduction piece because instead of injecting, it saves your. It's not as much. I guess it's not as potent. I'm not exactly for sure. But I guess I was practicing harm reduction in that way and didn't even know it. Right. So a lot of us out here may be practicing harm reduction just to get us to live another day and not even know that we're using harm reduction.
Yeah. Okay, so I want to point out something that I think is really important for our viewers and listeners, is that the notion of harm reduction is not the same as abstinence. Yes. That's very important because there is that stigma associated with harm reduction in that why is this not an abstinence-based approach? And much like, let's go back to diabetes, okay? So here's an example. I'm treating someone for diabetes, and I'm looking at their blood sugars, right? Blood sugars or hemoglobin A1C, fancy term to say what are your blood sugars like over the past 90 days, okay?
Right.
All right. So I'm viewing that, and on some visits, it's up, and on some visits, it's down. And on some visits, it's up, and some visits, it's down. That's called recurring, relapsing, remitting. That's one of the criteria for a chronic disease. Well, we have the same thing in substance use, right? We have times where we're using more substances and times when we're using less. Or none, right? But it's up and down. So that's part of it. Okay, so that's definition of chronic disease. We got that, right? Abstinence-based basically says nothing. So it really is tough for people to grapple with, so wait, if I'm not absolutely using nothing, I'm a failure, I am not in treatment, I am not successful. It's a lot of weight. It's a lot of weight to carry. And sorry, Quinnie, let me just finish this and then you go. But it's the equivalent of trying to get control of your diabetes, and then maybe one day not going for your 4-mile run. Maybe it's one day, going out with friends because it's Memorial Day coming up.
Right.
And you want to have pizza and have barbecue. Maybe things that aren't, I'm throwing air quotes, recommended for someone. That's right.
Yeah.
No,
and all
you're
of those
right.
are not an abstinence-based approach.
No, you're
but
right.
who would say otherwise? But when it comes to substance use, there's a lot of folks out there that are still pushing this. Abstinence is the only way to go, and that's contrary to the notion of harm reduction. Quinnie?
So, yes, and so I just want to comment on that. Everybody has their own pathway of recovery.
Yes.
And it's up to that individual on how they perceive their recovery. As for me, yes, I'm abstinent, but there's several people that I know that are functioning, that are glowing, blowing up, doing good things, but it has nothing to do with not being able to function and do the things that they need to do. It's their own pathway. Like some people feel like, I know me, okay, I'm abstinent because I have to be. I know I want to be because I know that I can't take a drink.
Sure.
It's knowing what you can and you can't do.
Yeah, absolutely.
So I'm abstinent. So the next one is they make a choice because they know that they can have a drink or whatever they choose to do and still function. I'm not that one. So, but I don't look at them no different. I do not pass any judgment because that is their pathway. That's their recovery. They're still standing. They're still working. They're still doing what they need to do. So that's how I feel. Even with diabetes, everybody's diabetes is different.
Yes.
They treat everyone differently. Like, yours might be really high, yours might be really low. I mean, glucose level, whatever it is.
Yeah.
But, but it's
Mm-hmm.
not the same. That's the same with harm reduction and your recovery and abstinence and all that. We're just going to put it together.
No, you're
It's
right.
not the same.
It's not the same. It's
not the
Yeah.
same.
No, it's not the same.
Yes. I'm just all aboard for this harm reduction and getting the word out there. I felt like I knew everything, just actually being someone who used and suffered with substance use disorder. I felt like I knew what I should have known about that. I had no clue about harm reduction. It makes so much sense, though, because in research, it shows that relapse is part of recovery.
Absolutely.
It happens.
Absolutely.
It truly happens. And just knowing that there are programs out there that are actually helping others to find clean needles to use, just helping them with groups to non-abstinent based groups that won't kick them out and actually find out what's going on. Why did we relapse? What were you feeling? What were you thinking? Things like that. That will help you. Maybe you can use that skill that you just learned, and the next time you think about using, try to go through those processes each time till one day you're strong enough to say, "Hey, I'm not going to use today."
Right.
And I think that's why we do have harm reduction, because one day it will kick in to, "Hey, I don't have to use today."
Right.
Yeah.
Not today.
And it's literally 1 minute at a time,
That's it.
an hour at a time, a day
day
at
at
a
a
time.
That's it.
It literally
That's it.
is.
Yeah,
Yes.
absolutely. So you all, 2 points that just triggered thoughts that I had. Which one do we want to start with? Okay, so harm reduction. Amani, you had mentioned that I didn't know that just altering the way that I'm taking in the substance
Yes.
is harm reduction. And it absolutely is.
Right.
Look, in the world of substance use, I guess we view, I'll just give one example, like IV, so needle. Needle use is one of the most high risk.
Yes.
Right, high risk. It hits hard, and then there's all the possibilities of what can go wrong with using a needle.
Yes.
You're penetrating the skin and blood. So infectious disease and all those kinds of things, right? And we kind of come across this all the times. I mean, this might sound horrible. I mean, we might have viewers and listeners who are like, I can't believe that quack doc is mentioning stuff like this, right? And that's okay. And that's okay. But again, I want to let you know that I come from an evidence-based background, which means this is kind of what the data shows. And following the harm reduction principle, we have, because I treat pregnant and postpartum individuals,
Yes.
we might have folks who are using, I'm just going to give you an example of needle IV heroin. Okay. They're using multiple times 7 days a week, and they're pregnant. But they might not be ready for treatment.
Yeah.
They might like using heroin. Okay. And this is going to lead to a point that you brought up, Quinnie, and I'll dive into that.
Okay.
But if I can get them to go from using heroin needle to using heroin smoke,
Yes.
that's a win.
Yeah.
It is.
I know that
Definitely.
I'm now reducing the likelihood of those downstream
Yes.
effects,
Right.
right? And that's without really changing much. So that's some of the principles behind
Right.
harm reduction.
I
All right.
love how you
Yes,
explain
definitely.
that. I love it.
Yes, yes.
And then, Quinnie, you said something that is very meaningful. Not that what you
No,
said, Amani,
I
wasn't
totally
meaningful.
get it.
What you said was, can they function? And let me tell you a story. My sort of guiding book, not to be sort of favoring one religion or over
Right.
another, but we oftentimes use, air quote, I'm using the word Bible as like a book that really guides this person in that thing. So in the world of psychiatry, our Bible is the DSM, Diagnostic and Statistical Manual. Okay? All right. So in there, it's going to say, here's a substance use disorder. Here are the 11 different criteria. Okay? In there, it says, here's major depressive disorder. Here is the X number of criteria. I mean, this book goes on and on for hundreds of pages of all this stuff.
Right.
Here's schizophrenia. Here's OCD. Here's PTSD. Every single one of those shares one criteria in common. And it's what you said, Quinnie. Does all of this lead to clinically significant functional impairment or distress?
I love that.
Right?
That is so true.
Technically speaking, if someone is not at the point of that, maybe we might not have to do anything. Right? Oh my gosh, the quack doc is saying, are you saying that I can be using heroin and technically I don't need to change anything? And I can make some arguments for yes. If you are able to go about, and if you're living the life that you want to live, is what
That's
I call it.
Yeah.
Yes.
And you happen to use heroin to stave off withdrawals, to stave off cravings, but you're able to be the mom you want to be, the sister,
Yeah.
the spouse, the whatever, the employee, the nurse, the physician. I take back the nurse and physician because when you deal with professions that have
Yeah.
licensing,
Yes.
it's a different story. Okay,
It sure is.
all right, but look at that. Right? You can still be using, and if you're not in a world of hurt with all that, so I just wanted to point that out, Quinnie,
Yes.
that is meaningful. It is important because some folks are not ready to change because it's almost like I'm imposing on them.
Right.
Now, I have it can sound a little bit morbid, but I have the luxury of pregnancy being a fantastic window of opportunity
Yes.
to get folks to consider
Treatment.
maybe treatment or
yes.
decreasing their use or changing their use because now what they are doing is maybe not just their own lives but
It's-
also baby.
Yes.
Right? And so despite them being functionally fine, a lot of pregnant individuals will say, yeah, maybe, but I'm interested because I am now, right? There's
Pregnant.
now two of us.
Now they have to have someone else to think about.
Yeah, so a
Yes.
little bit extra motivation
Yes,
that falls
definitely.
outside of that. But hey, that's 2 points I wanted to bring up because I think that's really important.
And
That's
I love
awesome.
that.
Yeah.
And I
Yes.
love that. I love
Yeah.
your point of view.
Right.
Yeah.
Thank
Okay.
you for that.
No, thank you all. Okay, so a little bit about the journeys. You know, we usually have the tail end of our podcast be the empowered part, right? The empowerments, right? So we're looking at empowering individuals and our listeners to what can they do for resources and support? I think in this case, our topic is harm reduction. So what are some recommendations? What are things that you all know are now in our communities? Given how the landscape has changed over the past several decades, what would you say? Try and have our listeners go for it, Quinnie.
Yes, this
Well,
is you.
what they can do is if they harm reduction, if they have any. Sorry, my mind just stopped. But anyway, if they want to reach out to the Empowered Program, all they have to do is call us, and we will give them all the information they need in regards to where they can get harm reduction items. Like we have Narcan in our
Yes.
office. We distribute it. I think we do have a distributing license.
We
have
do.
Narcan
We actually
there.
are.
We have
Absolutely do.
fentanyl
Yeah.
there.
Yes,
You also
the
can go to
fentanyl test
testing
strips.
Test strip, yeah,
We do
fentanyl.
not have fentanyl on site.
Sorry about that. Yeah, fentanyl test strips.
Testing
Sorry.
strips.
Not fentanyl, but
Well, you
yeah.
know, okay, Quinnie, technically speaking, we are located within a medical university institution.
Right, yes.
So for pharmaceutical purposes, we may actually
How
have
so?
fentanyl available in the buildings, but not specifically
Not
at the
specific,
empowered
yes.
at the empowered offices. Okay.
Love it.
Yeah.
You are, thank you for that correction. You also can go to Track B to get some information in regards to harm reduction. They have the fentanyl strips there, as well as the Narcans, naloxone, and any information that you need.
Yeah, and Track B also has those vending machines that we
The
talked
vending
about.
machines, yes.
Oh,
They also
awesome.
have vending machines in the MAT program.
They do.
Yes, and
Yes.
BHG.
Yeah,
So
yeah.
they have them at each location. Well, I know personally because they have it at Desert Inn and at McDaniel.
Okay.
Yes.
And for our listeners, this
Yes.
is very Clark County,
Yes.
Nevada
Oh, yes.
specific, which is
Yes.
southern Nevada. And for all of you who are outside, it's basically where Vegas is.
Yes, definitely. Sorry about that.
No, not at all. No. Amani, what are your thoughts on how can we get folks to, what should they do? Should they reach out? Should they
Yes.
stay in the shadows?
No,
Should they be
of course
ashamed?
not.
No.
And never feel ashamed. Never feel ashamed. Take that shame and use it and get some courage and go out there and actually seek some resources. Like Miss Quinnie said, Empowered's a perfect place to start for if you want to know if the drugs that you're indulging in have any fentanyl in them, or if you are a fentanyl user, making sure that you are actually using fentanyl. The Narcan, just to make sure someone else doesn't overdose or yourself doesn't overdose, educating those when you are using on, hey, what to look for when someone is overdosing and how to administer that. Just educating your friends and, family.
Yeah.
I feel like you really do have to be proactive because it honestly is really scary out there in the world of drugs right now. It's a whole lot of overdose going on. It's super scary.
stuff
So
out
you
there.
really have to get out there and seek help.
Yeah, definitely.
It is super scary, and a lot of that super scariness is because of what we've talked about, which is fentanyl, particularly
Yes.
fentanyl.
Yes.
There's a really good campaign. It's called One Pill Can Kill. We weren't there before.
Yeah.
So, Quinnie, if we went back 20 years, 30 years, and it was the world of substance use, was there really anything where one pill could kill? You were worried that maybe this just one time I'm using this substance, I'm going to use methamphetamine, I'm going to use cocaine, I'm going to use heroin. This could easily be the last time I ever use a substance. Was there that fear? Was there that notion?
Not for me.
Yeah.
Not for me.
Yeah. What about now?
For now.
Yeah.
Yeah. I definitely. You don't know what you're getting from what it seems like. It's just like the catamine, for instance.
Yes.
Yeah.
It eats your body up alive.
Right. Yes.
Your skin. When I
Horrible.
seen that, I was like, they didn't even have nothing like that when I was.
Right. Yeah.
Using-
I know.
I'm sorry.
It's
I'm like,
so
can you rewind that?
It's so scary. I seen it. I was like, what is that?
Yeah, now we've got substances like xylazine,
Yeah,
blah, blah,
yeah.
blah, 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 blah. I mean, just fill in the blank.
Yeah.
We are unfortunately now in a world where the chemistry, science is really good
Yes,
and really
it's-
advanced. And we can
yes.
come up with a lot of synthetic, fentanyl is a
Yeah.
synthetic opioid. Why is that different? Let's go a little bit into that. It's different because back in the day when we had things like heroin, morphine, those brand names like Vicodin, which are like hydrocodone, forget that, right?
Right.
Those were all opioids. Let's call them natural opioids, which means at the end of the day, someone need to have grown a poppy
Yes,
plant
I was thinking
in these
that.
countries or wherever. So someone needs to had grown something.
Right.
Which, if you've all ever tried to grow something like a tomato plant, it requires work and it's not
Yes.
always successful.
Yes, you're
and
right.
it limits. There's like a natural
amount.
limit to what can be out there, potencies, all those kinds of things. Now with fentanyl, which is a purely synthetic opioid, we don't need any of that.
No.
I can sit in a lab, and right here in the corner of this podcast studio, with something that would fit in a water bottle, I could annihilate all of Clark County, 2+ million
that's
people.
so sad, too.
That is wild. That is wild. So that's why I think we really need to be advocating for these best practices. If you don't want to call it harm reduction, don't. Frankly, do I care? No. But for anyone, if you know, whether you're a family member, whether you're a friend, whether you're a significant other, whether you're a clinician, okay, this is important too. For anyone that we know that is using substances, we say, here we go. I want you to have all these Narcan, opioid reversal kits.
Yes.
Okay. We call it Narcan, which is brand name.
Right.
The generic name, which we should be calling it, is actually naloxone.
Yeah.
Naloxone.
I know I call it both narcotics.
Yeah. So I want everyone to have that. Personally, we have several in various locations. Our kids know. That quack doc is telling his kids about drugs and how to save people's lives.
If you're not, someone else is.
The quack doc is, because if my kids know about CPR, my kids will know about overdose.
Yes, and how to save a life.
Sorry, that's where I stand. Let the negative comments come in as me being a horrible parent.
But I'm going to be honest,
agree.
Dr. Farzad, if you're not educating your child about drugs, I'm going to be honest, somebody else is, and it might not be the way that you want them to educate. So this is a conversation that needs to be had.
Definitely.
We were taking DARE. Well, actually, you know, it's funny, rewind back to the harm reduction. When I was in 5th grade, I made a pledge to, you know, DARE was a program that we
just say
had.
no.
Yes, exactly that.
When was that? Was that Nancy Reagan?
I don't remember.
That's purportedly yes. That's the sort of
yes,
correct.
but yes, I mean yes.
So these were based on sort of harm reduction, and I don't think the term even existed back then.
Right.
It didn't.
But things like this, and absolutely youth education and youth prevention,
Yes.
of course, is following along the principles of. But whether you want to call it that or not, fine. But have Narcan available. So we make sure every patient of ours who is seeing us specifically for, oh my gosh, at minimum has it, but we
Yes.
give them extras for their friends, for their families.
Yes.
This is the whole just hand these out, okay? The safe injection stuff, absolutely. The fentanyl test strips, absolutely. We talked about fentanyl is ubiquitous. What are some numbers? So let's say in 2022, over 110,000 people died from overdose. The majority of those overdoses involved an opioid. The majority of those opioid-involved overdoses were fentanyl related.
Right.
Even methamphetamine overdose, you know, that's far and few in between. But you throw the fentanyl in there, and now you have an overdose when someone thought they were just using meth. So there you go. We can't ignore it because fentanyl is it's murder.
It's murder.
It's murder. And, you know, there's like government agencies who are looking at classifying certain amounts of fentanyl.
Yeah.
This is a criminal justice discussion. I'm not going to pretend to be an expert in any way, but they're looking at making it, classifying it as amounts of it as a weapon of mass destruction.
Right.
Because a table full of fentanyl can probably take out the U.S.
Wow.
That's wild,
That
guys.
is.
Okay, we talked about this. So those are 3 things which I think just absolutely get them out there into the communities because they save lives. They save lives.
Yes.
Ultimately, that's what I'm here to do. That's sort of my duty to you all. That's my duty to our communities, to our state, to our nation, to our people of the globe.
Yes.
To our people of the globe. Any final thoughts, Quinnie?
I just was, was in thought right now because I was affected. One of my family members, my cousin's son, he died of fentanyl. Him and his girlfriend, when they found him, they were in bed holding hands. The thing that affects me the most is that I just wish that whoever was there with them, I could have gave them Narcan, but we couldn't find them.
Yeah.
There was at one time that I would go up and down Las Vegas Boulevard looking for him because I've seen him there before. My cousin would call and say, if you see him, stop. And, I would do that anyway. But we hadn't seen him this time for the last 3-4 months, and then come to find out that him and his girlfriend had OD'd. So, but yeah, it's very important.
I mean, that's the reality.
It's
of it.
very
It is.
important
That's the reality of
to
it.
get these harm reduction items, get them out there,
Just get them out there.
so we can help save more lives.
Get them out there.
Yeah.
Yeah. Amani, final thoughts?
Yes. Miss Quinnie, just listening to your story really is it's very humbling to know that you just really can't be judgmental. And I'm just going to leave it at when you truly help get this message of harm reduction out there, and actually all the avenues that harm reduction just goes into, all the different categories, just it helps somebody find harm reduction. Because when you help that one person, you help not just them, but you help their families. And that's the biggest thing. I know that my addiction took a toll on my family, and I know now they are just so happy that I'm just here where I am right now. And just knowing that you could save somebody from losing a family member it's just phenomenal. And this is why we do have to get that message of harm reduction out there.
Yes, definitely.
Let's unstigmatize harm reduction.
Yeah, totally.
And please do not be afraid to ask for help.
Yes.
We're here.
Yes.
We're here for you. We have the resources.
What are my
Yes.
final thoughts? Well, number one causes of death in this country, 15 to 44-year-olds, you can actually take it down from 10 to 50-year-olds. By far and away, nothing is even close, is overdose.
Right.
No,
That's
you're
it.
right.
Overdose. Okay, so we're talking about something that is killing a significant amount of people. These harm reduction strategies reduce that kill rate, reduce those numbers. Ultimately, whether you want to judge harm reduction principles or not, know that fundamentally, at the end of the day, it's to help keep people alive a little bit longer.
Yes.
And no matter who you are, the person themselves, a family member, a clinician, a lot of stigma within healthcare, right? If a person is dead, your relationship with them has ended. So whether you want them to
you're
get better
right.
or not, to use stuff,
It's too late.
That's the ultimate. And if you're happy with them being dead, which means that you got them to be abstinence-based and stop their use, that's a less than ideal way of viewing treatment.
No,
okay.
it is.
So with that, Quinnie,
Yes.
thank you for being here.
Thank you. I loved
Yes.
being here. Thank you for having me.
Yeah.
Thank you. You are
Also,
truly inspiring.
Yeah, I mean, I will say that I'm extremely lucky to have met you and to now be able to call you a friend
Yes,
and a coworker. I love it. Your impact in people's lives is invaluable. Okay, that means I can't place a value on that.
I feel the
Thank you
same way
so much
about
for
you.
being here. And like you've mentioned to all our viewers and listeners, get help, reach out, all that stuff.
Yes.
And in closing, thank you for listening or watching
Yes.
this episode of Empowered Voices. Be sure to subscribe wherever you get your podcasts.
Click the
as
like button.
another episode drops in 2 weeks. That's kind of what the schedule we're shooting
Yes.
for is. Also, don't forget to rate and share with others who may find our information and discussion topics helpful. And lastly, if you have a recovery-related topic you'd like us to discuss or to cover, please visit empoweredmoms.org/podcasts to submit your ideas to be considered for future episodes.
Yay.
Thanks, y'all. Until next time.
Thank you.
This was awesome.
If you live in Southern Nevada or in Reno, Carson City, Churchill County, or in Lyon County in Northern Nevada, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. Again, empoweredmoms.org. If you live outside of these areas, we really encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Roth, with production assistance by Rachel Mack. Writing assistance by Troy Stefano. Recorded at the Video Podcast Studio at Canico Media in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.